Walk Indians here in California, and I'm also familiarly related to the Pit River Nation of Bernie and to the Nisenan Maidu tribes. I'm very honored to speak with you today about some of the tobacco work that we're doing here in California. And my background is in public health. I'm a DrPH, and I have my career started in clinical operations at UCLA, but then I was honored to go home and work with CRIB, the California Rural Indian Health Board. And now I am working with tribes directly in the Central Valley of California. This program today is funded by the California Department of Public Health Tobacco Control Program. I'd like to turn it over briefly to my colleague, Selena Donahue, for her to do a brief introduction of herself while I bring up today's presentation slides. Selena, why don't you go ahead?
Hey, Young. Hello. My name's Selena Donahue, and I am Pueblo Indian, and my family is Hoopa, Yurok, and Karuk. I've been working in public health for the last 10 years. I also have 17 years of clinical pathology experience. So thank you, and I'm glad you guys are all on this webinar today. Back to you, Jackie.
Thank you so much. So today's presentation, the title is Commercial Tobacco and Vaping Cessation in Tribal Communities, Moving from Concept to Action. I also just briefly failed to mention that the tribal organization I work for is the Native Star Foundation, where I'm the project director of the Red Medicine Tobacco Prevention Project. I also have an appointment at the UCSF School of Nursing in the Department of Social and Behavioral Sciences. Okay, so we're going to get started since we're running a little bit behind. We'll go ahead and try to breeze through some of our material so that we can catch up. Brief disclosures. This presentation, as I mentioned, is funded by the California Department of Public Health. Neither Selena nor I have any commercial interest in the content of the presentation. And then most importantly for the both of us is that we do want to mention that we understand that one or two or multiple individuals represent the American Indian perspective. What Selena and I are doing is bringing our public health professional work and tribal backgrounds to you today and sharing with you our experiences in our work. Our learning objectives, I think you guys have seen on the flyer that was provided. And then finally, we'd like to start off by saying that we do this work that we do with permissions from the tribal communities that we work with. As I mentioned, I'm tribally related to 3 tribes in Northern California, but my work is conducted in the Central Valley of California. So it's with the permission of the Yolomni Yokuts people that the Red Medicine work is hosted in their homelands. Selena, would you like to mention where you're doing your work from?
Yes, so I am on the ancestral homelands of our indigenous nations of the Hoopa, Yurok, Matole, Tolowa, Wailaki, Wiyot, and Karuk, and other original inhabitants of Humboldt County. Also, if you guys want to go ahead and please put in the chat whose land you are on, just so we can honor our ancestors in the lands that we are caretakers of.
Terrific, thank you. So we're going to go ahead and take a dive into our work. Hold on one second, I need to get rid of some controls. Okay. Okay, so we want to start off by saying we understand that tobacco cessation is essentially a pretty tremendous public health success in California. The Department of Public Health's tobacco control program has experienced an approximately 73% decline in population level smoking rates from the beginning of the program in 1989 to the most current rates. And then we see that smoking rates have declined to about 6.3% in the most current data sets. That said, there are still some challenges. And so we look at the overall tobacco use rate in California, it's still being at 10.9%, despite the fact that smoking itself has declined to 6.3%. So we have to critically analyze what is accounting for those differences. And then despite the successes, we understand that disparities persist. For today's discussion, we're going to be focusing on the fact that American Indians in California, despite California's lower smoking rate, still experience the highest smoking and tobacco use disparities when we look at categories of individuals by race and ethnicity. We want to acknowledge some of the other disparities that exist and understand that we need to disaggregate the data when we're going to think about addressing some of the disparities that we see when we go beyond the population prevalence levels. And then finally, we want to mention that for us, it's extremely important that we further disaggregate the data and look at regional differences. So I'm offering you today a snapshot of the data from the counties that I work in which are Kern, Kings, and Tulare counties. When we look at the data in California for American Indian adult smoking rates, it rises to about nearly 41%. And that for me becomes not just a smoking disparity, but a health inequity and even maybe to the level of a health injustice. So that gives us a better perspective when we start to disaggregate the data and really see what we're working with at a more local level. And then, of course, we have to acknowledge that difference between the overall population levels, tobacco use rates and smoking rates. And we know that some of this is accounted for by the increasing threat of new commercial tobacco products. And of course, we're thinking about vaping, e-cigarette devices, and other non-combustible commercial tobacco products that are out there and are of high interest, especially to our youth populations in the communities we serve. So when we think about this, we want to talk about it in a different way that's more through the tribal lens and the Native perspective. So I'm going to ask Selena to share her thoughts because she actually created this snapshot of how we think about the work that we do. Selena?
Yeah, thank you. So when we approach and thinking about moving, quote unquote, upriver, that means advancing tobacco-related health equity by addressing the structural and social drivers on all three levels. And we can't just do this with one or two, we need them with all three. So number one, considering the individual needs and the network. Number two, consider the institutional drivers of the health inequities. And number three, at that community level and those social determinants of health. So really when we're thinking about, and Jackie we'll do a deeper dive into these, but think about moving upriver on all three of these levels.
And then Selena, can you mention quickly what upriver means for where you're from up there in Northern California?
Yeah, so this is on our reservation up in Hoopa, and really moving upriver, that's how, when we're thinking culturally, our salmon move upriver, when we do our dances, so really just that moving upriver has that cultural, so when we're wanting to implement culture and really bring that in, we even got to use that language. So, really just moving upriver, and that's how we're going to advance and, really trying to address these, disparities.
And of course, when we see moving upriver in communities, it has a lot of meaning. It's a signal to folks that you're going back to that source, right? That you're going to where things begin.
Yeah.
So I'm going to go ahead and move forward, and we're going to start with level 3. So we're going to do a backwards countdown on the levels that Selena has introduced to us. And so the first level that we're working with is level 3, because we're starting at the bigger sort of macro level. And we want to mention that when we're working on tobacco in our communities here in California, we're talking about centering tobacco. So for us, this means reclaiming our traditional relationship with tobacco and sort of working with the community to help identify what that looks like. And so it means also for us on a systems level that we're not just centering our work within a single agency like a clinic. It means that we're moving outside to work with some of our other agencies and institutions within the tribal community. So in the case of the Red Medicine Tobacco Prevention Project, we not only work with clinics, but we'll work with schools, and we'll work with housing, transportation, language and culture, other, environmental departments. We're working with other agencies within the tribal system. And then it's important for us to note that we think of this about it when we're talking outside of the tribal communities. We're talking about health and all policies approach, even if we don't begin with policies. And then we tailor our approach for each of the sectors. So we don't just come in with a clinical perspective or come in with a policy change perspective. And of course, the goal is to sort of get at social norm change, where we get our communities to think about sort of an anti-commercial tobacco position and think more about a position that respects culture and tradition. We wanted to offer sort of the framework that we're talking about, because oftentimes people are not working outside of their own sector. So if you're part of a clinic, you might be more focused just on the clinic. This is our logic model for the Red Medicine Project, and we began with the premise that we would work with at least 30 different organizations within the tribal communities that would include clinics, but also include other entities. Just going to highlight a couple of specifics. So if we're working with those different agencies, one of our goals was to promote community-based cessation support. And so part of our goal was to work with youth so that we could increase their knowledge, both culturally and about tobacco, and then hopefully, help them to increase their knowledge and capacity sufficiently so that they would contribute to the short-term goals of commercial tobacco norm change, which of course we are also ultimately trying to get increases in quit attempts, quit rates, and then reductions of those long-term cancer-related disparities that we're most concerned about. But just so that you can see, the pathway upriver really begins with multiple sectors. And then when we're talking about, again, working with these different sectors, and we call them non-traditional partners, and that again is outside of the tribal community, and often tribal governments are set up where they're segmented into different sectors. So understanding how we work with each of these sectors and perhaps bring them together, but again, just an example of how we tailor our efforts to the specific sector and be flexible in the way that we're working with them. And here I've highlighted how we work with TANFs, or temporary assistance to needy families, the tribal organization or tribal programs that many tribal communities have that service their populations. We call these efforts policy systems and environmental precursors. So one of the ways that we think about this is that if we're going to start by doing outreach, we need to introduce our program. We need to see what the interest is from the particular sector. So instead of just looking at tobacco as a health issue, we might approach the environmental department and say, okay, what are some of the reasons why you might want to prioritize tobacco that are environmental related to your work in the environmental department for your community. And then we assess the tobacco work buy-in from the community. And we do this all as part of the proceed model or framework, where of course we want to build trusting relationships. We want to understand our sector's base and needs, and we want to understand what their sensitivities are to based on their social, cultural, and economic context. And then finally, our goal is to really establish sort of a longer term commitment so that we could take a deeper dive in our work. So in order to illustrate how this has worked for the Red Medicine Project, we wanted to offer a data set that we took with one of our tribes located in Central California. We were asked to come in because they had perceived a youth vaping epidemic. And the first step that we took was to do an assessment with employees who were representatives of education, recreation, language, and culture, and the environmental department. And so the first question we asked was, how concerned are you about smoking and vaping in your community? And you can see there was an overwhelming response that it's a concern to a great concern. And then the second question was, does your tribal clinic or health program have a program to assist American Indians to help quit smoking and vaping? And only 7% of the respondents answered yes, which we could see there's some work that needs to be done there. And then, do you know what the California Smokers Helpline is? And overwhelming 93% either didn't know or were unsure. And then the California Smokers Helpline has gone through a rebranding process known as Kick It California. Unfortunately, the respondents that answering no or unsure rose to 96%. And then what would you do if you wanted to quit using commercial tobacco products? And of the different response possibilities, the ones that we would hope they would answer at higher levels, which are the evidence-based supports, we've got 0 responses from. So you can see here that 59% don't smoke, but that means 41% have some sort of think that they have some sort of exposure or do smoke. And it's unfortunate when we see 19% of the respondents answer that they would use cold turkey as the mechanism for quitting commercial tobacco products. And then, how many people close to you or your family, friends, or relatives smoke or use commercial tobacco products? And we can see that the exposure is great in this community. And as I mentioned or showed you in the earlier graphic, where it shows the commercial tobacco use rates in the Central California area, this absolutely reflects that reality. And then, have you or someone you ever tried to quit smoking or vaping but could not find any resources to help? So this is an unfortunate statistic, and all of this data set shows us is that, one, there is a problem, and the problem is not just recognized in clinical data sets where it shows the level of people who smoke. This is perceptions that go beyond the clinic and represents how the community employees are thinking about this particular issue. So when we talk about the model that we mentioned, pre-seed, proceed, for us, it's very important that we start with assessing on a broader level outside of the clinic and see how they think about things, because then we'll know sort of a readiness or a willingness to engage in some of the work that we want to offer them, or the supports that we want to offer. And then our next steps for us for engaging in PSC changes is really to offer, not just go in and say, you know, we want to help people quit smoking. We want to break it down to what we can support each of the sectors with, whether it be materials, technical assistance, offering assistance at events. And then we want to leverage our networks so that we bring in other experts and partners to help the community where they need help. So this may not be tobacco related, but we need to have them view us as partners who can help them achieve what they want to achieve, which includes commercial tobacco work. So I'm going to hand it over to Selena. She's going to share with you some of the actual events and work that we've done in the community and reflects the communities that we work with. Selena?
Yes, thank you. And I'm so glad you mentioned, bringing in those experts and those partners, and all these pictures are perfect examples of this. So here to the left is Kelly Vera, and she did a really great job. And she was talking about protecting our tribal lands, traditional burnings, plants. And so this was part of our the 2023 Earth Day event. And so again, bringing in those partners and those community partners. And then also, this slide right here, working with cultural to reclaim those tobacco practices. And what is really good about this picture is you see multi-generations. And so you see tribal leaders, you see our future generations. So this picture is all these multiple pictures from that day is just really getting that community together, getting the youth, getting those tribal communities and our future leaders together.
So I wanted to just mention on the previous picture that Carrie Vera actually had led the youth in doing a tobacco offering at a water source in this area, which is the traditional homelands of the Tule River people. And she's a Tule River tribal member. And then here in this picture, we have Tule River tribal culture bearers and also neighboring tribes showing the community or giving a hands-on experience with community members and engaging them in those cultural practices, which, as Selena's mentioned, for us, it's a really important piece of reclaiming tobacco, is not just talking about it, but having those actual experiences, which we believe are regenerative. It's not just showing people what needs to be done, but having them integrate the good relationship with tobacco into their lives. Go ahead, Selena.
Yeah. And again, it's just that multi-generation, so again, you can see to the left that future generations, they are there. And even on to the right, all the t-shirts that were handed out, those t-shirts in their tribal language say, we are praying for our earth. So it's just really empowering. So, when we're talking about how can we integrate culture into this, these are perfect examples of how we can integrate community partners, tribal leaders, and our youth.
And I also want to mention that you see in the picture with the youth, they had committed to doing a tobacco and cigarette butt or commercial tobacco waste and litter cleanup at this on these lands. So this is these pictures are our third annual event of this type, and we have families who return and who look forward to doing tobacco cleanups, getting the cultural experiences that they get, but we also give them a lot of education on the harms of commercial tobacco during this. It's usually about a 4 to 6 hour event that we do with the community each year. Okay, we're going to turn it over and start talking about level 2, the institutions that we're working with. Just briefly, we're going to go through, again, the policy systems and environmental supports that normalize prevention and cessation. And then we're going to ask ourselves whether those supports are culturally aligned, reflective, and respectful. So for this part of the presentation, we're going to focus on clinic work. And we want to go back to our Surgeon General's report and mention that, according to the Surgeon General's report of 2020, it is absolutely essential that clinical interventions for smoking be implemented into clinic settings in order to undo the harms of the smoking and vaping, or the commercial tobacco epidemic. We acknowledge that tobacco use is correlated with the social determinants of health, mental health challenges, and co-occurring addictions. So for us, it's really important to acknowledge that our clinic settings are a vital asset in these efforts to reduce the disparities that we see. So then we have to ask ourselves the next question is access to equitable cessation treatment available to American Indians, American Indian populations? And here we see from a report from the California Tobacco Control Program that unfortunately American Indian populations have responded that they have the least amount of requests or interactions with their clinical providers about their tobacco use. So here, demonstrates a huge opportunity for clinics to engage in more robust work with American Indian populations. So our takeaways for this sector is that we really need to make tobacco screening a vital. We need to ask at every visit, and we need to make sure that that's integrated and consistently done throughout our tribal systems. The next thing we need to think about is the screening the effort shouldn't stop at the screening level. We really need to take it to that next level, which is to provide a brief intervention, evidence-based. We have the 2 A's and an R, we have 5 A's, and we need to normalize the quit discussion. This is an opportunity for a provider to engage the patient. It's a trusted person. Usually there can be mistrust, but this is a way to build that trust and to update patient knowledge on some of the new products that are out there, some of the newer concerns that may be associated with smoking or tobacco use behaviors, or just providing new information that you could give to your patients, even if they're not ready to begin a quit journey. Okay. And then one of the big gaps that we've seen in the reports here in California is that providers are not prescribing to the level that they could for some of the medications that help support people to maximize their quit efforts. So one of the recommendations that we are asserting is that providers need to put it into their workflow to prescribe medications or offer the prescription of medications. They also need to offer proactive referrals to either helplines or to other programs that may be within their clinic. I want to take a moment to mention that one of our partners, the Lake County Tribal Health Consortium here in California, has actually integrated cessation screening or tobacco screening and referrals to tobacco quit supports in their the dental side of their clinics. And they are seeing much more, they're seeing a tremendous amount of referrals coming out of their dental program. And that makes me very happy. My career began in the School of Dentistry at UCLA. And actually this graphic here was part of a set of materials that my team created at CRIB. When I first started at CRIB, the very first grant that I wrote was integrating smokeless tobacco treatment in dental clinics. And so, some 15 years later, it's great to see that this work is being done, and Lake County Tribal Health Consortium is achieving great success in getting referrals from their dental side of their clinic. We also want to talk about provider team training. When we're talking about working with the American Indian community, where there's this existing relationship with tobacco, which may or may not be known to the patient population, it is important for providers to have cultural competency training because one, we want to respect cultural tenets and cultural practices. And even if people are not as familiar with their cultural relationship with tobacco, tobacco is ever present in tribal communities, whether it's used for funerals, as offerings, used in ceremony. And we need to bring back some of that cultural knowledge and have that normalized, but we also need our providers to understand that there is a difference, which may not mean that every American Indian person smokes as a norm, but that they do use tobacco in their communities, and we need to respect those practices. So the more they know, the better they can care for their patients. Here is a picture of one of the youth that we work with in our tribe in Central California. And, you know, you can see that we are keeping the message current about keeping tobacco sacred. And here's just a number of different training opportunities that providers can engage in order to build their competency around this topic area with their team. And then finally, we want to mention that with respect to the facilities, to clinic facilities, we look at system changes to improve health equity as a messaging thing, or as a norm around various activities, such as having a smoke and vape free policy, asking yourself, do you have signage or media that both rejects commercial tobacco use, but also affirms the cultural use of tobacco, and then whether you have treatment flows that have assigned tasks that are documented in the medical records or the electronic health records, and that, you know, whether you have care that is coordinated outside of the clinic encounter. And so one example that we wanted to give you is our work with the Bakersfield American Indian Health Project. They are in Kern County, and here's a snapshot of the team. And right behind them, they are posed in front of signage that we helped them to develop. And here you can see that they take it a step further, where they mention that they do not allow for commercial tobacco use. They do allow for spiritual use of tobacco. And these words are put into action by every community event that they hold is a commercial tobacco-free event. They open their events in that way, and we've been very blessed to partner with them and attend them at the different kinds of activities they have, where they are not just saying this message, or they're not just asserting this message in their signs, but they're actually putting it into action. Okay, one other product that we want to show you that we have developed with Bakersfield American Indian Health Project, which brings in the youth voice and kind of goes from signage to more action-oriented activities, which I want to share with you now.
I don't think we can hear if there's any volume.
Yeah, Jackie, we can't hear the sound.
Okay. Sorry about that. Sonia, can you tell me how we do the sound?
I think remember when you share your screen, there's like the bottom left corner with like share sound before you start sharing.
Okay, let's see here. I'm going to take it out for a second, guys. Share screen. Apologies. Technology is not being friendly to me today. Okay, let's see if this works. Can you hear it?
Yeah, it works.
I can't. Okay, thank you.
Hi, my name is Leora. I'm with the Tabata tribe.
Hi, hello. My name is Malachi. I am Kashaya and Alempomo.
My name is Evelyn. I am from Standing Rock tribe.
Out here and we taking over the Capitol, and we get to meet Assemblyman Ramos. So come with us on that adventure. I now see some cousins of mine using something that was once so beautifully sacred to us. deeply sacred plant that we use during our ceremonies into something that has been corrupted and taken for granted. Big Tobacco brought the fight, let's unite to make it right. Big Tobacco brought the fight, let's unite to make it right. That's what I like to hear.
It's the flavored tobacco and everything. Yeah. I think because a lot of kids like sell it to other kids and it's just like, I don't know, it's a trend.
And being able to have that voice now, right, against the ills of tobacco and how it's plaguing our people. So continue to be that voice.
Okay, so I just wanted to mention briefly that that product was all youth driven. You can see that it's not professionally done. It was something where we had the youth do the video, do the sound, but it was a product that was requested by the Bakersfield American Indian Health Project as something that they want to play in their waiting rooms and to show the community how youth are being engaged to work on the tobacco issue with their clinic. So I'm going to wrap up this part on clinic work, and just by mentioning that part of our sort of grounding is in reframing tobacco use through a culture as prevention lens. A lot of communities across the country, tribal communities, are using the same approach. We think of it as a larger movement in the reclaiming traditions and cultures, whether it's around sovereignty, food, or a host of land stewardship, a whole host of other, topic areas. But we want to wrap this up by saying that we believe that some things are effective in tribal communities that we work with, such as small media that is culturally driven. Here we're offering a product that was created by the United Indian Health Service, one of our partners in our cohort, who's been doing this work longer than any other of the tribal agencies in California. They do tremendous work reflecting their community. Both of these products come from them. But then we also want to mention that for us here at the Red Medicine Project, we have engaged our culture bearers. Here we have a person from the Tabatalabal tribe who was doing a tobacco talking circle in language and then translating it to English, sharing with the community how they properly use traditional tobacco. And here we also work beyond our tribal communities with partners who are non-native. So in this example, we're working with the U.S. Army Corps of Engineers, teaching about the various medicines that are used in tribal communities and how we respect our traditions, which of course for us, the starting point is tobacco. I'm going to go ahead and turn it over to Selena now to talk about level number 1, or at the individual level, some of these same concepts that we've been sharing. Selena?
Yes. Okay. Thank you. So we'll talk about that level 1, that individual level. Next slide, please. So really, that framework, that culture is prevention. So successful prevention efforts need to be able to hold on to complex of the truth in the Native American communities. And so really understanding, our history, understanding that historical trauma, but also understanding the truth and that how this culture, our culture, is going to be prevention, and not just for tobacco, but for all health issues and cancers. Next slide. And by doing this, we believe in using our way. So as Native Americans, we have the wisdom to find the solutions. Our knowledge, education, and way of learning has been through gathering, storytelling, songs, and they are passed down through generations. So really, when we're talking about this, how can we integrate that culture piece, that how that culture is prevention? Because that's who we are, that's how we learn. Next slide. And like Jackie said, in the prior picture, they were doing talking circles because that is our way of teaching. That's who we are. We gather that information through songs, through dance. So really, when we want to implement that culture piece, how are we talking about that prevention? It's not just, are we doing cessation programs? Are we eating healthy? So how are we implementing that culture piece to this as well? Next slide. And again, we really talk about that, understanding that historical trauma, understanding that truth, but also that healing as well, because historical trauma is entirely different than constantly holding on to the past when it resides in our memory and our DNA. So again, this is past, a lot of this trauma is intergenerational trauma. And that's why we have a lot of pictures showing that those multifamilies, those generations, because that's who we are and that's how we're going to move forward to that healing piece. Next slide. And again, we can't talk about, that culture prevention and healthy living without really talking about other, smoking tobacco. We know that's going to cause other health issues. But again, weaving in that tradition, how can we do that? Are we eating traditionally? Are we incorporating those traditional foods? Are we exercising? That's not saying going jump on a treadmill, but we could be doing that by gathering, our bear grass, making regalia. And again, getting screened because we know that smoking tobacco could lead to other cancers and even getting screened for lung cancer. Next slide. And again, this picture is just, I really enjoy these because this is really living that cultural way, teaching, listening, passing down that knowledge. And that is really key when we talk about culture is prevention.
Selena, can you talk about what's happening in this picture?
Yes. So on the left, we are fishing. We're eating our traditional foods, and actually this night we got several salmon and sturgeon. But on to the right side, that's an elder. My husband, he's really teaching, my son-in-law, my daughter, my nephew, and so really that picture says it all. That's how a lot of our culture is passed down. It's through that storytelling. It's through song, and the youth really will stop and listen. So we got to really making sure that we are integrating that culture piece. So when we're talking about tobacco cessation, again, are we, do we have those programs for, maybe diabetes, maybe for healthy eating, really taking a look at to make sure that we have and we are integrating that culture piece to this.
I do also want to mention the Lake County Tribal Health Consortium example that I gave of the dental department doing screening and referrals. They've created a tobacco program within their own clinic setting for tobacco cessation. And they are integrating both sort of the clinical approaches and also trying to build out some of the cultural approaches. And, the focus that Selena and I have offered today are trying to mix the two. It's how do we utilize some of the evidence-based approaches out there that have been shown to be effective with what we know to be effective in tribal communities, especially I'm thinking about prevention. The youth do respond. The youth that we've worked with are very responsive to having the opportunity to learn culturally about the differences between commercial and traditional tobacco. And for them, it resonates far beyond just the health topic sort of thinking into how to respect their ancestors and respect the cultural backgrounds that they come from. The next sort of challenge is thinking about how and if those approaches could be effective for a cessation approaches as well. So I think, Selena, that's the last. Oh, I'm sorry. Do you have other
No,
slides?
yeah, and then again, really, when we're talking about cessation and all this tobacco work, really making sure that we're leading a healthy lifestyle for better outcomes for all health issues, because we know statistically smoking is going to increase your risks for a lot of those other health issues, and that's including cancer. So again, on to the right, that is my daughter, who is medicine girl, and she is actually packing traditional tobacco. So again, really, talking about what that traditional tobacco is used for and really living that healthy lifestyle, because it is going to help decrease, a lot of those other, cancers and health issues that are correlated with smoking.
Okay, that is a wrap on our presentation. I'm going to go ahead and stop sharing. And we can open it up for questions or comments or any sort of discussion that anybody would like to engage in.
Yes, this is Ed Napier here. I'm with the Skull Valley Band of Goshutes. Hello, dear.
It's been a long time. Great to see you. Great to see
No,
you.
it's been a long time. For those of you who don't know, Jackie and I used to work together quite a long time ago through the California Rural Indian Health Board. And that was wonderful. It's good memories. But, I think you can understand what I'm saying is, so I'm not a smoker, never have been. But, when you talk about things such as historic trauma, it's still a little cerebral for me, because I haven't experienced it personally until lately, when a good friend of ours, her sister was actually our sister-in-law, is going to be coming into our drug and alcohol treatment program. And when she knew that she was here, she wept. See, and the reason why, she never recovered from her father's suicide. See, and it's taken what, 15 years perhaps since she's been able to have an opportunity to deal with that. So it's become a little bit more cerebral to me now that I fully understand that. It's hitting close to home. But the other thing that I wanted to say, and you might remember, my big thing was always the connection between diabetes, I am a diabetic, and nicotine, and it's something that a lot of our people don't completely understand. And one of my understandings is as simple as this: nicotine prevents the body from producing nitric oxide, right? Which allows our blood vessels to expand when we need more oxygen. And that's what helps create high blood pressure. See, those simple things, it's good for our people to know that. I'm so glad to be back in this discussion. I don't know if I've said anything that's of any value, but it's like I say, it's good to be with you, and I shall be making connections in the future, because, being as I work with the alcohol and drug treatment program, commercial tobacco use is not a priority. They think they still think it gets in the way of recovery. And so a lot of our clients are outside smoking, using vape, and so it's something that I would like to bring to this agency. And I've said enough. It's just a delight to be back with you all. Thank you.
Thank you so much, Ed. It's so great to see you. And your questions for me are extremely important. I do want to acknowledge that in this presentation, we didn't focus on things like commercial tobacco use being the leading cause of preventable death. We didn't focus on the intersection between the 30 different cancers, 20 different chronic diseases. I sort of felt like people in this forum would know about the harms of tobacco, but it is an interesting discussion for us to think about. How do we gain the interest of the different sectors we're working with? And that's where we wanted to focus on, if we approach different departments, we might have to tailor and figure out where their interests are and figure out how to engage them. And then we can bring them into that conversation about the various different intersections between mental health status, other SUDs, and how we can bring tobacco in and prioritize it. So I acknowledge that we didn't spend the time on that, but that is, we shouldn't forget. Yeah, we
Yes,
absolutely.
I'm sure it's going to happen in the future. There's a lot to talk about, but you know how you discussed utilizing the different entities. It's got to start there, doesn't it? And then, of course, for my thing, where does it start? With the youth.
100% in agreement.
Thank you very much.
Thank you so much, Ed. I'm delighted to see you. Would anybody else have any feedback for us? We love the discussion. We intentionally left the time for discussion since we didn't just want to talk at you, but hopefully you can feel comfortable with sharing some thoughts. Okay, so we do have a question in the chat. So there was a question. I don't know, Kathleen, if you want to read the question in the chat. Or any other questions?
So Van is asking, is sacred tobacco use universal in California, or does it vary by the native nation?
Excuse me.
Yeah, I think it's really important to mention that here in California, there's 110 federally recognized tribes and probably 80 to 100 that are either actively seeking recognition or are independent tribes. It's one of the most diverse, linguistically diverse groups in the entire world, or areas and regions in the entire world. So there's a lot of different customs and different uses, cultural uses of tobacco. So I don't want to speak for anybody, but you know, in our work with our various tribes, the one thing that we do is we go in and we try to make sure that we are deferring to their customs, and we do see that there are differences. But a couple of things that we mention is that, first of all, there are 7 different species of native tobacco in California that are indigenous to California that were used by tribes. Second is the tobacco that you see used in commercial tobacco products, in cigarettes, in cigars, and in other combustible products. That tobacco isn't even indigenous to the mainland of the North American continent. It's indigenous to the Caribbean. And when we start to tell people about how tobacco was colonized, it was taken up by Christopher Columbus and sold globally and used as a product for sale, it starts to open up people's mentalities, their mindsets about the differences in our tobacco. And it can contribute to people wanting to protect our traditional tobacco even more. I think in California, one of the biggest pushbacks that we've gotten is, given the development and colonization of the region, how the access to traditional tobacco is not what it needs to be, and tobacco traditionally wasn't sold. So, you know, it produces a sort of catch-22. How do you get rid of commercial tobacco when traditional tobacco is hard to come by? And you know, and so there's some issues there, but we are working with people to grow tobacco. We're trying to make space for the use of commercial tobacco in traditional settings, but it is difficult because that commercial tobacco is tainted. It's processed, it's got the chemicals, it's got all the harms that we see. So we're starting with knowledge building and capacity building. I hope that answers your question.
May I add something, Jackie? Here in Utah, people are becoming more comfortable now with using what they used to use traditionally, you know, sweetgrass, red willow, those sorts of things. They've gone back to that. But the reality is, you know, I tried growing the nicotine plant in my backyard. It grows amazingly well. In fact, the next season, some of the seeds got into the brickwork on my patio and started growing there. So it does grow here very easily, but like I say, our people are more comfortable with what they've used traditionally, and I like that trend.
It's great news. Kathleen, was there
So
other
we have another, oops, it scrolled down. Cassie asks, what are the best ways to ensure cultural relevance when developing marketing campaigns for tribal populations? Actually, how do we, part of it cut off. How do we, instead of with tribes focus groups, how should we communicate coming from state control programs?
Yeah, that's a great question. I'm gonna say quickly something and then I'll ask Selena and maybe even Kathleen. I mean, you guys do this kind of work too. So anybody who does this work, if they want to weigh in, but I think for us, we have scrapped the whole idea of stock photos. We go and work with our communities directly. We ask for permissions to, you see all the photos that we shared with you today are all from the community. And we make sure we have those permissions and we vet things with the community. I'll tell you, when I do presentations with my community in different sectors, whether it's education or environmental, I always vet the deck with the staff before I do present anything. So I don't, and it's amazing what you learn as a professional when you go to the community and you ask them to be the lead in terms of what you're developing. So that's what I have to say. Selena, do you want to?
Yeah, I always say, bring in those tribal experts. In Western medicine, you could be the expert for the Western medicine, but really bring in those tribal partners, bring in those tribal people. Like Jackie said, we used, for my slides, all my own personal slides, Jackie, from the community. So again, and making sure you ask permission, don't just take. So again, and it is hard, because up here in Northern California where I'm at, my cultural foods are going to be very different from, in Arizona or in Southern California. So again, really bring in those people from that community, and they are the experts. So we got to be able to weave in that Western health medicine with our traditionals, people and communities as well.
And Kathleen, maybe you have some thoughts about this too, because I know Crib is really, really good at developing sort of community reflective promotional materials.
Yeah, I think I'm just kind of along the same lines where I'm so happy to see that we're working with our young people and gathering, photos from our communities. And at the same time, though, always making sure that we are authorized to do that, or if that's just something they want to share back with their own community. Because sometimes something that's developed, is not meant to be, shared out widely. It's just for them to use. And so, but it is a challenge. We work within our organizations to teach even our own staff and to work with the state. So like it can seem kind of daunting to undertake all that but it's so important. Our community is so, our spiritual elements are so intertwined with our work that here, we're funded by government grants to do that, making sure that we're making all of those protocols and making sure that we're asking and then working with our staff within our organizations to make sure that we are modeling, that we are leading those efforts. And these types of presentations where we're sharing stuff out, we're talking. I mean, this is the biggest thing. Let's talk to each other. Let's figure out what's working, what's not. How do we do this in the best way possible? Because all of us sometimes can make a misstep too, So it's good to be reminded.
I so appreciate those comments, Kathleen, because I do want to mention that this is not easy. And oftentimes it's so easy to make a mistake and it's so easy to accidentally go outside of your lane. And, checking yourself continuously, being reflective and being humble, being culturally humble. I'm a California Indian person. I work in an area and live in an area that's not my homelands. And so I consistently ask permissions. I consistently check in and make sure that I'm being guided in a good way and that I'm not overstepping something by thinking that I know more than I do. So, and even then, even when you're being conscientious, it's easy to make mistakes and you have to ask for forgiveness. But I think being culturally humble and to be sort of always in a learning position and not from a I know or a knowledge-based position. It's more always learning, being open to what you don't see is really important.
And even learning from other tribes as well, so maybe, what goes on, maybe like up here in Northern California with my tribes might be completely different from another tribe. So again, we could learn from each other. And again, really making sure we ask those questions and ask permission.
All right, so we're at the top of the hour, so we do want to respect people's time. If you want to stay on for a few more questions or input, we're happy to stay on, but we do want to mention that it is 9 o'clock, so we do want to respect folks' time as well. And then Kathleen, we'll turn it over to you.
Kathleen.
Thank you.
I'm on mute. Yeah, as always. In the chat box, you'll find a link to our evaluation. Please fill that out. And then if those of you that were wanting CEUs, it's required that you complete that within the week, I believe it said. And so just wanting to make sure that all of you that needed CEUs did that. Those of you that may have been kicked off or didn't have good bandwidth, of course, we will have this presentation shared out on the National Native Networks webpage to share their, so you can see, sorry, I've just got the whole screen up, not in presentation mode, but this is their website. And so we'll have that posted later so that people can watch it later, share it with others, whatever you need to do. Yes, but please fill out the evaluation. It's over in the chat, and these slides and presentation will be available. And I really appreciate Selena and Jackie. Wonderful presentation. Thank you for bearing with us on our little bumpy this morning and fitting in so much information in such a short window. We know that all of us have busy schedules, so while we love to chat all day, we appreciate this condensed, 1 hour quick presentation. I don't think I have anything else in the chat box that anybody's asked. So yeah, thank you all for coming, and hopefully we can do something like this again.
Thank you.
Thank you so much, Kathleen, and thank you everyone for attending. Ed, we have to reconnect.